welcome to Wellness Wednesday with HealthTexas, a new segment we're going to be doing every Wednesday during the month of October. Talk about certain different topics related to healthcare and your health. I'll be introducing and having a guest on periodically to help go through some of these topics to better educate you and keep yourself healthy. So today I have Dr. Luis Torres. He's one of our family medicine physicians over at our Southwest Military Clinic. I'll go ahead and let him introduce himself and get a little bit more information for him.
So, as Steve said, my name is Luis Torres. I'm a family medicine physician. Been with HealthTexas for 25 years, same location, thank God. And this is a nice way, I think, to get out some good information to our patients and anybody else that might be viewing. So, thanks, Steve.
Great. Well, welcome. Today we're going to talk about the flu season, in particular the flu vaccine, something that is really important, and we want to make sure we get the right information out to all of our patients so they can make a good decision and hopefully come in and get their flu vaccine. So Dr. Torres is our lead medical director. I am an associate medical director with HealthTexas. We've taken a lot of interest and invested a lot of energy to make sure that all of our patients are going to get vaccinated this year. Dr. Torres, can you tell us a little bit why is it important this year to get your flu vaccine?
I think we all hear year after year, and especially, whether you're older, at work, from school age and up, about getting a flu vaccine every single year. And this year, it really, I think, is becoming more upfront, and people are hearing about it much more so because of the COVID infection.
So how is this year getting the flu vaccine going to help us, in the setting of the COVID-19 pandemic? How can this help us move forward and keep everybody safe?
The goal, as every year with the flu vaccine, is to try and limit the number of people who may get infected or who may have some serious effects from the influenza, especially as we get older. But even children can be impacted by influenza.
Yeah, I think it's a great point, and one thing to understand with the influenza, in every season, working in the hospital, we see patients, it's our busiest time of work in the hospital, it's influenza season. A lot of elderly patients with a lot of medical conditions, those are the ones that if they get the flu, it's not just a couple days at home and not feeling well, they can end up in the hospital. And if we have another spike or potentially another spike in the COVID infections, we have that alongside it. So we're trying to really, especially this year, minimize our utilization in the hospital. We want to keep as many people out of the hospital, keep as many people healthy as we can. Getting your flu vaccine this year is just one way that can really help that. Going back to the benefits of the flu vaccine. So for those who get the flu vaccine, is it going to prevent you from getting the flu? Is it just going to make it less of a mild case? Does it help with transmission?
I think it's going to be probably a little bit of all of those. I think some people it will help from actually, if you're exposed, your body will be able to deal with it and fight it off. For some, it may make you just have a milder form of the flu. But sometimes lost in the flu season is that our kids also they can be infected, and they also have some potentially significant effects from it. So, it's not just that our adults are in need, but parents need to think of everybody from 6 months of age and up. Because it's every year there are many hospitalizations of children for influenza. So, it's everybody.
Yeah, I agree with you. The flu vaccine, we can't make promises that if you get the vaccine, you're not going to get the flu that year. That's just not something that we know happens. You can absolutely still get the flu even though you've gotten the vaccine. However, we know that people who get the vaccine, if they do get the infection, it's much more of a mild case. From instead of being sick for 7 days or a week, you're sick for maybe 1 or 2 days. Or instead of being in the hospital because you didn't get your vaccine, you may just be at home and sick for a couple days. And the other important thing is there's fairly good evidence that those who get the vaccine, if they do get infected, they transmit the virus at much lower rates than if they weren't vaccinated. So It may not necessarily prevent you or significantly prevent you from getting the flu, but it can definitely prevent you from spreading it more. So another good question that I've gotten from a lot of my patients is the flu vaccine effective to help fight off COVID-19?
So unfortunately, it won't. It's not, we're talking about two different viruses, and that's why you hear about working on getting the COVID vaccine out as soon as possible, and that's because it's going to be two separate vaccines. So no, getting the influenza as a society, it's not always just for me as an individual, but it's me and what I can do to help everybody else.
That's a really important point. If you're on the fence, or maybe you haven't been so eager to get the flu vaccine in the past, but you're looking for ways of how can I help prevent and lessen the damage from the COVID-19 pandemic, getting a flu vaccine is absolutely something you can do. So again, highly encourage everyone over the age of 6 months of age to go out and get your flu vaccine. Another question I get a lot of times, and I talk with my patients about, is can you get COVID-19 and the flu at the same time?
So at this point, I would say that it is possible that you could probably be exposed, especially during this fall season, to both. Whether you would contract both, I don't know that there's cases, but there's no reason why you necessarily would not. So again, it's just being careful with your exposure to the COVID and following all the recommendations that are being put forth with the 6 feet and the face mask. But is it possible? It's possible, and you're just trying to limit that possibility. I think the biggest issue is going to be that somebody has fever, which is it? And it's getting to that decision point about now you're dealing with two possible infections that could look somewhat similar, especially early on, and for most people.
I agree with that completely. I think one of the biggest challenges that we're going to face every day in the clinic in the coming months is COVID or flu or something else. If someone comes in with a fever and cough and sore throat, there's a lot of different things that can cause that. And for us, prior to COVID-19, we had ways to diagnose and differentiate and treat and be able to take care of our patients. But now with COVID-19 out there, a lot of the symptoms overlap. It's going to be incredibly difficult to distinguish between whether this is a common cold, whether this is the flu, or whether this is COVID-19. And even testing is going to be very difficult because it is possible to get both infections at the same time. So if you go to your doctor with fever and a cough and some body aches and they say, well, you have flu, it doesn't always necessarily mean that COVID is not on board as well. And so what we're going to do this season and during the flu season with COVID out there is we're going to have to kind of stick with what we've been doing with the pandemic. So if you're not feeling well, stay at home, stay away from others, isolate yourself as best you can, stay away from those that are at higher risk of having complications from COVID-19 and the flu. These are very similar recommendations and very similar precautions that we can take. Everything that we've learned and we've been doing with the COVID-19 pandemic, if we continue that, I think this is going to be a very mild flu season. Everything we're doing right now, masking, washing our hands, social distancing, and staying home when you're sick, these are things that we should be doing every flu season.
So, you just said it, which is when you're not, first of all, is we're still in the COVID pandemic. So you're going to be using your face mask. You're going to be trying to, separate, keep your distance, 6 foot, try and limit your gatherings outside of your immediate family or group that you know. Once you are going through those, if you don't feel well, then don't expose other people. Stay home. You can call your doctor and probably will be able to get a visit by televisit.
And just to know, all of our clinics available to do televisits, you can see remotely to evaluate you if you're not feeling well. All of our clinics are also open and seeing patients in person if needed, should that be the case. Any other closing comments or any other things that you want to mention as far as the flu season or getting your flu vaccine?
One thing that I think all of us will hear, and that's every single, and probably not just flu, but in particular during flu season is, well, I don't get the flu season because it made me sick. So, I think the likelihood that somebody gets truly ill from a flu vaccine is very low.
And one thing that I tell a lot of my patients that are still on the fence, common myths about the flu vaccine. Can you get the flu from the flu vaccine? If you're getting the vaccine through a needle, meaning an injection, there is actually no form of live or reproducible virus in that vaccine. So it is not possible to get the flu from the flu vaccine if you're getting it through a needle, which is the majority of the vaccines that we provide. Now, a lot of times the most common side effect, especially if you've never had the flu vaccine before, or maybe this is only your second or third time getting it, some body aches, even fever can happen. You can feel like you're about to get sick. That initial kind of few days before you maybe get a cold or the flu in the past where you just feel kind of achy and run down, those are symptoms that can be pretty common after you get the vaccine. What I tell my patients is, I think of it as almost a good thing. So if that is your immune system ramping up, responding to the vaccine, identifying something foreign, and building up immunity. So it's okay if that happens. It should only last for about 24, 48 hours. Very mild. It should not progress into anything more than that. But again, I tell my patients it's kind of a good sign that your immune system is responding to this vaccine. Well, I think that's about all the time we have for this Wellness Wednesday. Torres, thank you for coming on and joining.
Thanks for inviting. It's good. I think it's good information for everybody. And remember, get your vaccine.
Absolutely. If you have any questions, give us a call at any of our locations to schedule an appointment with your doctor. Come into the clinic, get your flu vaccine. Again, strongly encourage everybody to get vaccinated. Tell your friends, tell your family, get everyone vaccinated in the household if you can. And just a reminder, open enrollment season is coming up October 15th through December 7th. We will have agents at all of our locations. If you have any questions about Medicare enrollment, or any insurance plan changes you're thinking about having this year, please give us a call at the number below. We'd be more than happy to help you out. And thank you guys again for watching. Have a good day. Bye-bye.